share very briefly concerning the AstraZeneca vaccine and just the vaccines in general that have been developed and have been approved for use against COVID-19. Many people are very concerned about it. There's a whole movement of persons who are resisting this vaccine. Some people, even here in Barbados where I live, have been marching in these streets, have been protesting against the vaccine being mandatory and so forth. So there is need for vital information on this vaccine. So what I want to do is I want to share first on, is this vaccine safe? Does the AstraZeneca vaccine in particular really work? Because some persons are saying that they are not going to take it because it doesn't work. What's the sense in taking a vaccine that doesn't work? Well, here's what we know. Forbes magazine has reported study finds that the Pfizer and AstraZeneca vaccines effective against the Delta variant. This is the new variant that many persons are concerned about, and there has been a lot of rumors, why should I take the vaccine when it isn't effective against the new variant? Well, actually it is effective against the Delta variant as long as you get both doses. It says both the Pfizer and AstraZeneca coronavirus vaccines work well at preventing symptomatic cases of the Delta coronavirus variant, which became a dominant strain in the US this month. But the vaccine's effectiveness dropped significantly in patients who only have one of the two doses, according to a new study. So it's very effective, but you need to get both doses. Now, it goes on to say a study of 19,000 people, so they're not speculating about this, okay? They have actually done the necessary research on persons who were infected and who did take the vaccine. A study of 19,000 people from Public Health England published Wednesday found that both doses of either the Pfizer or AstraZeneca vaccines help protect against symptoms from both the Alpha, which is the B.1.1.7, also known as the UK variant, and Delta variants at comparable rates. Two doses of the Pfizer vaccine had an effectiveness of 93.7% at preventing symptomatic Alpha infections and 88% for the Delta variant. Two doses of AstraZeneca were found to be 74.5% effective at preventing symptomatic Alpha infections and 67% for Delta. It goes on to state, however, the effectiveness of the vaccines plummeted if a patient had only received one dose of either vaccine. The study found both to be just more than 48% effective against Alpha and only 30% effective against Delta. Researchers said their findings support the theory that prioritizing second doses, especially in vulnerable populations, is an effective way to prevent coronavirus outbreaks. Now, this article goes on to say that the Delta variant, which experts believe is more transmissible than earlier forms of coronavirus, is thought to be the driving force behind a new wave of infections and a jump in hospitalizations across the US. Experts have warned about the danger Delta could pose. Former Food and Drug Administration head Dr. Scott Gottlieb said the majority of unvaccinated Americans will likely contract the Delta mutation eventually, adding the disease is going to be the most serious virus they will get in their lifetime in terms of the risk of putting them in the hospital. The surge of new cases has pushed some cities like Los Angeles and Las Vegas to reintroduce mandatory masking in some indoor spaces. So let's take a step back and understand what it is that these articles are saying. Even though a person might contract the COVID-19 virus after getting the vaccine, what the vaccine does is that it reduces the likelihood of their death because it makes their immune system a lot stronger at fighting the coronavirus. And so you will find that persons who take the vaccine, they do far better than those who do not. Even here in Barbados, the Minister of Health said that there are people in isolation, some who took the vaccine and some who refuse. And the ones who took the vaccine are doing well. It is the ones who refuse the vaccine who are on ventilators. So the vaccines are indeed effective, so that even if it doesn't stop you from actually catching coronavirus, you are more likely to survive if you take the vaccine than if you don't. So this is sort of like how there are some medicines on the market right now that may not necessarily stop you from catching a flu, but because they have built your immune system, they've built your body to be strong enough at combating it. The flu may not last very long in your system. You're able to fight it off a lot more easily. It doesn't really do the damage that it would have done if you were not taking care of your body, taking vitamins, taking different medications, and so on. So we can look at the vaccine in that light. So when people say that those who refuse the vaccine are putting the ones who do take the vaccine at risk because they are exposing themselves, this does not suggest that the vaccine is therefore worthless, because even with the vaccine you're at risk. Over 70% benefit effectiveness of the vaccine is still a very high percentage rate. 2 doses of AstraZeneca were found to be 74.5% effective at preventing symptomatic alpha infections and 67% effective against the Delta variant. So look, we know, for example, to use the illustration, that condoms do work. They do prevent people in general from getting the HIV virus, but it's not 100% certain. The condom could burst, for example. So obviously, just because a person is using a condom doesn't therefore mean that if they have intercourse with someone who is HIV positive, that they're not putting themselves at risk just because they are wearing a condom. Similarly, just because a person has taken the vaccine doesn't therefore mean that if those who do not take the vaccine are walking around without wearing their mask, without sanitizing and so forth, that the one who did take the vaccine is no longer at risk. It wouldn't mean that at all. At the same time, it doesn't mean that the vaccine doesn't work. So the vaccine works, but we still want to be careful, okay? Because nothing developed by human beings, nothing that imperfect mankind develops, is ever going to be 100% effective at all times, okay? Even if it's 99% effective, you don't want to be in that 1%. So what about the next question? The speed at which this vaccine was developed, because many persons have said that they don't trust the vaccine because it was developed too quickly. Vaccines normally take 10 to 15 years to develop, so I'm not going to trust a vaccine that came out so quickly. Well, we just looked at Forbes magazine, but this now is the UC San Diego Health, and they have addressed this question: how were the COVID-19 vaccines made so fast? And it's interesting, it says here that vaccines for COVID-19 became available in less than a year. In the past, it's taken many years to create a vaccine that's ready for public use. But over decades of creating vaccines, research groups and public health agencies have been making the vaccine process better and faster. So how did the COVID-19 vaccines happen so quickly? It turns out that a global pandemic can rally resources very quickly in many countries. This made a lot happen in less time. So the first point is that science started years ago. The COVID-19 vaccine got a head start from work that's been going on in science for a long time. Scientists have been working on processes for creating all kinds of vaccines for many years. The researchers have been watching and studying coronaviruses for decades. They are a very common type of virus. There are hundreds of types of coronaviruses, and scientists have seen two other serious types affect humans just in the past 20 years, SARS and MERS. Decades of research into DNA also made the process faster. The DNA genome or genetic code for COVID-19 was mapped within 2 weeks. This helped labs work quickly to target exactly what kind of vaccine could attack the virus. So that we understand what this is saying so far, it is saying that COVID-19 is nothing new because coronaviruses have been around for a long time. And scientists have been studying coronaviruses over the years and have been working on vaccines for coronaviruses over the years. So there already would have been stuff in production to fight coronaviruses. COVID-19 is simply just a new strain of coronaviruses. So you only need to do a little tweaking to the things you already had in development in order to get a vaccine ready for COVID-19, because this is simply a new strain of it. So it's like if you are accustomed to making pizza, so you're accustomed, let's say you have only been making let's say Hawaiian pizza, but this time someone wants you to make pepperoni pizza. You don't have to learn from scratch how to make pizza in order to do the pepperoni pizza, because you already have experience making Hawaiian pizza. You only need to slightly adjust your formula by putting some different toppings on it. So, instead of using a lot of, let's say, pineapples, maybe you use pepperoni, okay? So it's the same thing when it came to COVID-19. They would have already been working on things they had in development. They just needed to do a slight tweaking to adjust it to fit this new strain. So it's not that this didn't take a long time to develop. It did take a long time to develop because they have been working on developing vaccines for coronaviruses for many years. So we want to dispel that myth. Now, powerful partnerships. It says that in the past 10 years, when the deadly Ebola virus was spreading, experts realized the vaccine was taking too long to develop. What would happen when new germs started spreading and causing serious problems? Agencies and other groups around the world started planning ways to make new vaccines more quickly. When facing the COVID-19 pandemic, many groups decided to work together to fight it. Scientists shared information such as the genome for the virus. Groups of experts worked together to share data, raise money, and figure out the best ways to fight the virus. These groups included US Department of Health and Human Services, European Commission, the UK Government Vaccines Task Force, United Nations, which we know is like 193 countries, World Health Organization, Centers for Disease Control and Prevention, Access to COVID-19 Tools Accelerator, Coalition for Epidemic Preparedness Innovations, and Gavi, the Vaccine Alliance. In the US, a special Department of Defense program called Operation Warp Speed was created to help get COVID-19 vaccines ready quickly. Operation Warp Speed is a partnership of the US Department of Health and Human Services, the DoD, and many medical research and manufacturing groups. These groups agreed to work together closely to communicate and move through a process to develop safe COVID-19 vaccines more quickly. Are you really trying to tell me that with the incredible increases in technology we've had over the years, and with all these various agencies, businesses, and governments and so forth working together, that we would be unable to create a vaccine more quickly than we have in the past? Of course not. So it shouldn't be surprising. Funding is also an interesting part we need to look at. It takes a lot of money to research, test, produce, and distribute a vaccine. For COVID-19 vaccines, many international sources of funding came together. All of these sources committed billions of dollars in the efforts. Groups in the powerful partnerships noted above contributed or raised funds very quickly. Non-profit groups and private citizens donated money to the vaccine development too. So what normally takes a vaccine 10 to 15 years to develop is not the fact that we need it to be effective. It has nothing at all to do with how effective the vaccine will be that causes it to take 10 to 15 years to develop. The amount of time it takes to develop has nothing to do with how effective the vaccine is. I'll tell you why it takes so long to develop a vaccine: bureaucracy and red tape. Because first of all, it takes a lot of funding. So persons who want to develop a vaccine normally have to keep lobbying, keep begging and begging for grants to fund their different stages of development of their vaccine. So if the funding takes years to come, if it takes a lot of years to get the funding you need to pay for each stage in development, for each stage in testing of the vaccine, then it's normally going to take a lot of years to develop a vaccine. But we didn't have to wait many years to raise funds, because with this international pandemic, with this global pandemic, we had governments, businesses, non-profit organizations, private citizens donating billions of dollars to fund every stage of developing the vaccine. So you didn't have to wait many years to get the funding. The funding was already there. Another thing that normally takes many years to develop a vaccine is that it takes a long time to get volunteers. Because let's be honest, if you're not sick, your life is good, you don't want to become somebody's guinea pig for an experimental vaccine. It takes many years to get just a handful of people who are willing to be lab rats, to be guinea pigs for experimental vaccines. But with this pandemic, there were so many millions of people who had contracted this coronavirus disease, and people were dying by the millions. So people were afraid and were willing to surrender their bodies to be guinea pigs, if I could use that term, for the vaccine treatments. So you didn't have to wait years to get volunteers to accept the vaccine so that they could test it on humans. There were literally hundreds and thousands of people willing to take the experimental vaccine. So all the years of waiting for funding and for volunteers was completely stripped away, because under these circumstances, you had everything that you needed. You had the money and you had the volunteers, and you already had many decades of research on coronaviruses available to us. So we didn't have to start from scratch in order to get the vaccine ready. And this is why it didn't take so long to get the coronavirus vaccine ready. Furthermore, we also have new incredible technology today that we didn't have back then in terms of what was on in the laboratories. So this was very well done in science. And here's even an additional point, because in science, for something to be accepted as proven science, it needs to be demonstrated not just by one particular team in their laboratory, but people in other laboratories around the world would need to test it, would need to verify that this wasn't a fluke, that this wasn't, these guys trying to pull a trick. But if it is repeatable by other people, well, then you know that it's definitely something that will work. And what normally happens is in science is that everybody wants the glory for themselves. So what one man finds out, he's not sharing with the next person. And it takes a lot of years when one person has encountered a roadblock that they cannot get past, but another person might have the answer, but they're not sharing it with him. So it takes a lot of years for the full picture to emerge, for all the knowledge to get shared. But in the case of this global pandemic, everybody was sharing information. So it cut down a lot of the time that it would have taken for scientists to all get on the same page in order for the knowledge about the vaccines and about the virus to be understood and accepted that this is what it is. So all of that cut down the time. Efficient vaccine testing. It often takes years for vaccines to be tested. The tests are known as clinical trials. They can take time to organize, gather volunteers, and then roll out one by one over many months. This is often the longest part of the vaccine process. For the COVID-19 vaccines, researchers were much more efficient in their testing schedules. There are different phases of testing vaccines on both animals and people. These are called phase 1, 2, and 3. In the past, these tests were spaced out over years, but for COVID-19 vaccines, many volunteers were signed up quickly. Phase 1, 2, and 3 trials happened with different groups in overlapping schedules. Vaccine approval agencies looked at testing data as it was happening and didn't waste time. So you didn't have to wait years in between the 3 stages, the 3 phases of testing. Rather, the 3 phases of testing were happening on overlapping schedules. So again, this would have cut down the time it took to make the vaccine. Notice that none of these things that cut down the time it takes to make the vaccine have anything to do with the actual components of what it takes to make the vaccine. It has nothing to do with how effective the vaccine will be. It's just cutting down through the red tape that it normally goes through to make the vaccine. So it's kind of like if you're preparing a meal, but you have to take a lot of time to get all the ingredients of the meal together. It takes a lot of time to get the funding to buy the cheese and the macaroni and the spices and so forth. And then the stove, you're lighting the stove, but the gas goes out, and then you have to go and buy a fresh bottle of gas, and all of these are hiccups that is causing the meal to take a long time to prepare. But the fact is, if you have everything in place already, that meal can be prepared on the stove in just maybe half an hour. That meal can be prepared very quickly. It doesn't have to take a long time. The thing that causes it to take a long time is a lot of red tape, bureaucracy, those kind of things like funding and volunteers. But the actual vaccine itself, it doesn't have to take a long time to develop. So how were so we've already gone through the testing, making data a priority. U.S. government agencies and task forces that approve vaccines allow themselves a lot of time to work. They take time to receive data, look at data, have meetings, talk about the data, and decide what to approve or not. They have many projects in progress over time. So basically what normally happens that takes vaccines like 10 years to develop is that you've got a request for the agencies to look at your research for your vaccine, but what happens is that your file gets put beneath a ton of other files, and they take a lot of years before they even get around to dealing with yours, because they have a lot of other things on the table in front of them that have been presented before your idea. Okay, so they're going to take time to get back to yours, and when they do get back to yours, they may schedule some other meeting to discuss certain aspects of it with other people before they come to a decision. And I'm telling you, here in Barbados, I'm currently going through the court system with a matter, and I had a case that took a lot of months before it got before the court, and then it got adjourned till 2 months later, and that kind of thing. And this happens in business as well. This happens in the medical community as well. People look at something today, and then they schedule a meeting 6 months down the line, and then if there's some other issue that is more important that comes up, they might not see you until the following year, and all that kind of red tape, right? But information was being shared very, very quickly. People looked at this as a priority because people were dying. It was a global pandemic. So for COVID-19, these agencies and task forces acted quickly to make the COVID-19 vaccine the priority. This meant that they got data faster, looked at it right away, and discussed the data while the clinical trials were happening. They didn't have to wait until after all the clinical trials were done. They were already meeting and discussing these things in real time while the trials were going on. They also use a process called emergency use authorization. This means the FDA fast-tracked their decisions based on the data. How were the COVID-19 vaccines approved for safety? Well, the COVID-19 vaccines you can now get have passed many tests in labs and in thousands of people. They meet strict standards from the FDA. Almost 300 COVID-19 vaccines have been in process around the world in the past year to be tested for public use. Only 2 have been tested and approved by the FDA so far. These vaccines were tested first in animals, so it's not like they skip any part of the development process to make sure that the vaccine is viable. They didn't skip anything, they did it all. It was already tested in animals. They were then tested in a series of clinical trials that included thousands of people. Okay? Thousands of people. So they know that it works. All of the data from these tests was collected and submitted to the FDA and other scientific groups. These committees of scientists and public health experts carefully look at the data to see if a vaccine is safe and effective. If the vaccine meets the FDA's strict standards of safety and quality, the agency tells the vaccine company they can make the vaccine for emergency use. So let's understand something here. That the AstraZeneca is effective is not just the opinion of the FDA. If you want to say that the FDA is lying about the vaccine, then the US Department of Health is also lying. The European Union is also lying. The UK government vaccines task force is also lying. The entire United Nations is lying. The World Health Organization is lying. The Center for Disease Control and Prevention is lying. There are a whole host of people throughout the entire medical community that you would have to claim are part of some kind of global conspiracy. Now, I am yet to see anyone bring forward any actual real proof that the vaccine is harmful or that the vaccine is responsible for any death. Okay? Work on the vaccines hasn't stopped. Anyone who gets a vaccine can give information about their personal experience. You can contact the CDC's Vaccine Adverse Event Reporting System. The CDC also has a phone app called the VSafe app. This app gives you a way to check in and report if you have any side effects from the vaccine. In some cases, a person from the CDC may call you to ask more questions. The CDC also tracks the vaccine in care facilities throughout the National Healthcare Safety Network. So what I'm saying today, what I want us to understand is that we have good reason to trust the vaccine that we have. Okay? Now, there have been people who claim, but look, this person took the vaccine and they died afterward. If you're going to say that because a handful of people who took the vaccine later on died, this is your proof that the vaccine is harmful and is causing people to die, then you have to explain why is it that so many millions of people who took the vaccine are still alive? Why didn't they die too? So the reason why that handful of people died cannot be because of the vaccine. And let's face it, if you give the vaccine to, let's say, 1 million people, and out of that, 1,000 people died, the fact is, there are people who are sick that were going to die anyway, whether they took the vaccine or not. There are people who are dying with cancer. You know how many people die from cancer every day, from AIDS every day, from pneumonia every day? How many people die from all kinds of other things every day? Every day people die. So the fact that some of those people who are going to die anyway took the vaccine doesn't prove that therefore the vaccine killed them. You have to listen to the medical community to find out what was the cause of death in those specific instances. And if you're going to claim the cause of death was that they took the vaccine, you have to explain why so many people took the vaccine who didn't die. Because most people that took the vaccine are still alive. So I'm not buying this conspiracy theory that this vaccine is killing people. I just don't buy it. As for side effects, the government and the medical community came out and told us that these vaccines do have side effects. And so some people will have side effects, and we were told what those side effects would be, and we were told how long these side effects are supposed to last. So for certain individuals who have been putting their side effects on social media to discourage people from taking the vaccine, or simply being a bit dishonest with the public, because nobody is hiding anything about these side effects. You can go to the World Health Organization website right now and look at what the side effects are. And everybody who takes the vaccine doesn't get side effects. I know a lot of people who took the vaccine who did not even have those side effects. These side effects are only occurring with some people. Okay? Now, as for those religious ones who want to say that this vaccine is the mark of the beast, let's just see what the Bible says about the mark of the beast, because I don't want us to get carried away. So in Revelation chapter 13, this is what the Bible actually says about the mark of the beast. In Revelation 13, and it says from verse 16 to 18, he also forced everyone, small and great, rich and poor, free and slave, to receive a mark on his right hand or on his forehead, so that no one could buy or sell unless he had the mark, which is the name of the beast or the number of his name. This calls for wisdom. If anyone has insight, let him calculate the number of the beast, for it is a man's number. His number is 666. Now, for those who want to say that governments making the vaccine mandatory is the same thing as the mark of the beast being forced on people, let's understand that according to the Bible, if you take the mark of the beast, you're not able to buy or sell. Everyone I know who has taken this vaccine is still able to buy their groceries. They're still able to sell whatever they want to sell. So right there, this ain't the mark of the beast. Okay? And if you want to go deeper into scripture, when does the mark of the beast occur? Does it not occur after the rapture? Doesn't it? Research it and see what you occur, because as far as I understand it, the rapture has not yet happened. Okay, and I do not see any connection between the AstraZeneca vaccine and the number 666 at all. So again, that's just the way it is. Now, to be honest with you, let's just say, for argument's sake, that the vaccine wasn't effective. If you take the vaccine and it's not effective, what do you lose? I mean, I've had the flu sometimes, and I might take a Panadol and it didn't work. So then I had to take something stronger. Did I lose anything by taking the Panadol? No. So even if you believe that the vaccine is not effective, you're not losing anything by taking it. You're not committing a crime. You're not doing yourself or anyone else an injustice. Furthermore, as for those who are pomposetting and grandstanding at the vaccine being mandatory, let me say a few things. Number one, vaccines have been mandatory for a long time though, because whenever a baby is born, it is mandatory that that baby, at least here in Barbados, I can't speak for all around the world, but I know that here in Barbados, when a child is born, it is mandatory that that child gets vaccinated. He gets vaccinated for measles, rubella, polio, whatever it is. They get vaccinated for chickenpox, etc. So you have to get vaccinated, and it's mandatory at birth, okay? And if a baby, an innocent, helpless little baby can survive vaccination, I don't see a reason why an adult cannot survive vaccination. Number two, let me also say, the Barbados government has not made the vaccine mandatory. They haven't. And in fact, the Minister of Health has publicly stated that doctors take a Hippocratic oath that if a patient doesn't want a certain treatment, they can't force it on the patient. So any business that wants to force their employees to take the vaccine, there are ways that employees can respond. They can appeal to the labor office. They have unions. They can seek legal redress. If someone claims they were fired unfairly because they didn't take a vaccine, well then they can take the person to court for wrongful dismissal. There are ways to deal with these things other than violence, other than, protesting in the streets and causing havoc. The government of Barbados even permitted people to march in the street and against the vaccine. But from my understanding recently, those people went beyond the point where they were supposed to be marching to. They went beyond the time that the demonstration was to last, and a number of them started to get violent, and so the police and task force had to be called in order to quiet the crowd. And many of those people that I could personally see in the video of this event were not even social distancing. So they weren't acting as if they believed that COVID was something real. And this is sad because COVID-19 has killed millions of people around the world. It's very serious, okay? Very, very serious. And I think that our government has gone above and beyond to accommodate people in Barbados. Where they complained about the curfews, government did their best to adjust the curfews at different times. They have been very lenient with persons. In fact, persons who broke the curfew, many of them either did not receive the full fine that they were supposed to receive, or some of them weren't even fined at all. So I think that in our country, we have had people being very lenient. There's a situation right now where persons in Barbados are even being paid by employers as an incentive to take a vaccine. Imagine that. Like Sea Hill Supermarket said that they're paying $300 to persons as an incentive to take a vaccine. Somebody paying you to take care of your own health? I mean, that is beyond reasonable. That is beyond leniency. And we need to treasure the type of peace that we have here in Barbados, because in other countries we see a lot of rioting, a lot of looting, a lot of craziness happening when it comes to these type of situations. So we need to appreciate the level of decency and decorum and peace that we have on the island of Barbados. We need to keep it that way, and stop buying into all the conspiracy theories, because if you're saying that you can't trust the government, you can't trust the medical community, but you could trust some anonymous stranger on the internet who makes claims. If there is medical evidence, scientific proof against the vaccine, by all means, present it. And I never challenge anyone who is listening to me right now, who is against the vaccine, to comment and give me a source, give me an actual medical source where it has been proven by anybody in the medical community that the vaccine is deadly, or it's harmful, or that it doesn't work, etc. I would challenge anybody to show me where this evidence really is, because it just seems to me to be a lot of hearsay, just like they came up with the whole conspiracy with the 5G network, that all of it was just a lot of hearsay. Because persons with who were getting sick weren't getting sick because of the 5G network, because how then did they recover without the 5G network shutting down? It's not like if they leave the area where there was a cell signal. Okay, so I mean, like these kind of things, we need to be careful. We need to be careful, because a lot of fear is being spread out there through propaganda, and we can't do that to our neighbors. We can't have our neighbors living in fear. So I hope that this message has helped somebody, and I pray God's blessings on you and on your family, and God bless.